Hi everybody, Dr. Mike here. Let's continue our journey looking at the different layers of the gastrointestinal tract. Well, we call it histology of the gastrointestinal tract. So in a previous video, I said to you that the very first, most internal layer of that big long tube that extends from the mouth all the way down to the anus is called the mucosal layer. And the mucosal layer is made up of three separate layers. It's got the epithelia, which lines the inside. This is a barrier that protects one environment from the next environment, and I said the epithelia changes as we move from the mouth all the way down to the anus. The next layer underneath that is the lamina propria, which is loose connective tissue and contains blood vessels, nerve fibres, lymphatics. And then the next layer is a very thin layer of smooth muscle, two layers in fact, one called the circular layer, which goes around the hollow inside, and a longitudinal layer which goes the length of the hollow inside. And what that does is it changes the diameter of the microenvironment, helps push things through, tells glands to release some enzymes and substances. So they're the three layers of the mucosa. Now let's look at the next layer called the submucosa. Submucosa is also connective tissue, just like the lamina propria. It's loose connective tissue, just like the lamina propria. Loose connective tissue means that the fibres embedded in the gels of this connective tissue, which are collagen and elastic fibres, they're loosely arranged, which means, like I've said previously, this connective tissue can be pulled around, it can be stretched, it can be distorted, and then just pulls itself back to its normal position. This is very important for the GIT. As foodstuffs move through, it's going to distort the diameter of the hollow lumen. Now this loose connective tissue of the submucosa, again, like the lamina propria, has blood vessels, lymphatics, and nerve fibres. But something very important here are the nerve fibres. The nerve fibres form a plexus. Now a plexus is like a braiding. When somebody's hair's braided, it's where all these nerves form these plexuses, all right? So like multiple braidings, and they're called either Meissner's plexus or the submucosal plexus. What do? Well, these nerves, what they do is they innervate the blood vessels so they can change the diameter of the blood vessels. It also tells glands, which are predominantly going to be extensions of the epithelia and lamina propria, right? Tells them to secrete their enzymes or substances that they're producing, and also tells the muscularis mucosa, this circular and longitudinal layer, to change its diameter as well. So in order for the blood vessels, the glands, and the smooth muscle in the mucosal layer to do their job, they need the Meissner's plexus or the submucosal plexus that's present here in the submucosa. These nerves actually come from another plexus called the myenteric plexus, which is located between these two layers here. These two layers are more smooth muscle. They're the most important smooth muscle when it comes to mixing substances and pushing substances through the GIT. Between these two layers is the myenteric plexus, and some of these nerve fibers penetrate through this layer to get to the submucosal layer to then innervate these areas here. So this is the submucosal layer of the gastrointestinal tract.